views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, January 26th. Coming up, we'll learn about Montefiore School Health Program providing COVID-19 testing in participating Bronx schools. Then, our very own Bronx nurse, Nurse Nare, joins us to provide some important COVID-19 updates. After that, a new tech training program is coming to New York City. Tune in to find out how you can get tech career training with Merit America, starting in February. And Digital is a platform for independent creators founded by a Bronx artist. We'll share how you can share your content and join this hub. So please, stick around. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at bronxnettv on Instagram and Twitter, and BronxNet Community Television on Facebook. Last month, Mayor Bill de Blasio announced that students would return to in-person learning in phases. The safety of students relies on increased testing and the COVID-19 test consent from mandate. Pediatric providers at 6 Montefiore School Health Programs clinics are now using new rapid testing to determine if children in school have flu, RSV, or COVID-19. Joining us now to share more about this program is Dr. Michele St. Louis, Director of the Medical Division of the Montefiore School Health Program. Welcome, doctors. Thank you so much for joining us today.
Thank you for joining me.
Of course. Just to start off, can you tell us more about Montefiore School Health Program and the program's mission?
So the Montefiore School Health Program is 31 campuses, and within those campuses, we service about 95 schools. And our vision for this program is to really reach out to provide health care for as many students as we can in those areas. And that includes in a comprehensive and interdisciplinary way. So we provide medical care, dental care, mental health care, as well as now vision care.
All right. Thank you so much, Doctor. And as we mentioned, Montefiore is bringing new rapid COVID testing to Bronx students in school. Can you share more about this initiative?
So this started with a partnership that we have with Dr. Amy Fox and the Department of Pathology at Montefiore. And it's an opportunity for us to provide this type of rapid testing on site at our health centers and what we call a point of care test, which is basically being able to provide the testing and get the results at the same time that the student is with us. It's a very exciting program that we're able to provide. And what's exciting as well is that this COVID testing that we're doing is done with the same machine that is used in the hospital. Mm-hmm. So the accuracy is the same as you were getting this test done in the hospital. It's very exciting.
Got it. And sounds exciting. And doctor, just to clarify, is testing going to be available at all schools or just at some of the schools participating in this program?
So as you mentioned in the beginning, we started with 6 schools. Those were the 6 schools that had done the feasibility study for flu. And now we're in a phased rollout. So we're in the process of expanding it to each of our schools. Right now, it's about half of our schools that have the capacity. And over time, in another few weeks, we'll be able to have that capacity in all 31 of our schools.
Got it. Another important topic for families, especially in the Bronx, is affordability, right, doctor? Are these tests free of charge? Do parents have to pay out of pocket for them? How is it going to work?
So all the services that we provide for enrolled students at the Montefiore School Health Program are provided with no out-of-pocket costs for our students. So if a family is insured, we do bill the insurance to help cover the costs. But if someone is not insured, they do not have to pay for the test.
Got it. And prior to the launch of COVID testing, Montefiore did hold a pilot study with flu tests. Can you share more about this study, doctor, and how it prepared other doctors to do the same with the COVID test this year?
So again, that was really due to the partnership that we have. They reached out to us in the Department of Pathology to start this initiative. And as I said, since the machine is the exact same machine that's used in the hospital, there was a process where we had to be trained on how to use the machine and how to do the testing. So thankfully, by doing that with the flu from last year, we were able to train everyone and they were very comfortable. So it was an easy lift to now train people on the COVID testing and expand the testing throughout all of our schools.
And what are some of the benefits of having children get tested in school as opposed to going to an ER or doctor, especially during these times?
Right. So I think what's really important to remember is that we're going to be providing this on site. The test takes about 40 minutes. So the student and their family will leave the school knowing whether or not they have flu, whether or not they have COVID. And it really has an impact on what the next steps are for that student. It's going to allow, if you find out that the student has COVID, then that allows for quick isolation and quarantine. And the goal of all of this is to decrease the spread in the school and the spread in the community. So that's what's really helpful about that. In addition, the reverse is true. So when you find out that someone in fact does not have COVID, it also has an impact because it allows for us to determine that the student may need to go home because they're ill with something else, but they know that it's not COVID. There's no exposure to the family. The parents can continue to go to work. They don't have to be quarantined. And so again, it helps to the community, school community, as well as the greater community.
Doctor, as we know, a lot of students are currently remote learning. Can students that are, not in person still get access to this testing in school?
We're really focused on the students that are coming to school, and we're looking for the students who might develop symptoms while they're in school. So that's really the primary focus right now.
Okay. Another question is, as we know, some of the COVID testing may be a little uncomfortable even for adults. Is this rapid testing, the results, as I read, are happen in 40 minutes, right? Is it going to be painful for the kids, or will it be a quick swab and they go on their way?
Right. Well, that's another thing that's really exciting about this particular instrument that we're using. What you've seen on television and other places is what's called the nasopharyngeal, which is a deeper kind of a test. But with this machine and the test that we're using, we can do a nasal swab, which just goes a short distance into the nasal passage. So it's much less uncomfortable.
Okay. And how do parents and teachers receive the results after the students get them in school?
So when we're going to do a test for the student, we call the parents to let them know what the concerns are and why we want to do the test. And we get that kind of verbal permission to do the test. And then by the time the parent arrives to pick up the student, we already hopefully will have that result and we'll have a printout for them that they can take with them.
Got it. And finally, Doctor, what are Montefiore's hopes, with this new initiative and, just anything you'd like to share with the hopes of this program?
Well, again, I think it's really a game changer in terms of being able to have our students and our families get this information quickly, getting it on site, not having to travel to the emergency room or to another facility to get that information. They get it right now, and then they can head back to home or do whatever else they need to do in their lives. And I think that's what's most important about this. And we also think, epidemiology, or public health point of view, it's really helping to decrease the spread by finding out quickly, finding out efficiently, notifying everyone that needs to know so that we can stop the spread in the schools and in the communities at large.
Thank you so much, Doctor. One last thing, actually, can you send a message out to parents on how to ensure that their kids are kept safe, especially, during this season, flu season, while it's cold and they're back in school? Just a quick message from a local doctor.
Absolutely. So it's the same basics that we have to do for all of this care, right? We want to make sure that people are wearing their masks. We want to make sure that folks are washing their hands or using hand sanitizer when they can't do that. We want to make sure that they're staying distant from each other as best as they can. All of those tools help decrease the flu. As you notice, there's not as much flu going around because we're doing the mask and we're doing the social distancing and we're washing our hands. That's the most important thing that you can do to help prevent spread of infection.
Absolutely. And where can people find out more about Montefiore School Health Program, Doctor, and this initiative?
So we're available on the larger Montefiore Medical Center website, but you can also follow us on Twitter and on Instagram.
Thank you so much, Dr. Michele St. Louis, Director of the Medical Division of the Montefiore School Health Program. Thank you so much.
Thank you so much.
We'll be right back with Open BXRx.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, and they want to be tested.
When things were happening in our community,
and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting
to the new reality.
Reporting from BXRx. Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people. Avoid crowds. Stay home if you can. Wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. As the pandemic continues, the demand for travel nurses is up. Our next guest is no stranger to our program. Nurse Narelia Oliveras-Arzuaga formerly worked as a nurse here in the Bronx, and she's now a traveling nurse. Welcome, Nurse Nare. It's always a pleasure having you here. Thank you for joining us.
Thanks so much, Sonyi. It's great to be with you ladies again.
Of course. So first, it says it in the name, I think, but I just want to clarify what a traveling nurse is and how your position has changed as a nurse since we last spoke.
Well, I'm actually still, for the rest of the month, I will be finishing up at Lincoln. But starting February, yes, I will be taking on a travel assignment. So what that means is it's applicable actually to anyone in the healthcare field. You don't need to be a nurse to be a travel healthcare worker. You can be a nurse's aide. You can be a respiratory therapist. You can be a doctor, a nurse practitioner. Anyone really is eligible to travel. What it means is basically you get quickly onboarded. So you get an assignment. Hospitals are looking. It's because they have a demand. So they usually hire a contract travel agency to get somebody for them. So they don't have to go through the legwork of doing the hiring themselves and going through their own HR. And what happens is once you're selected for an assignment, you get onboarded pretty quickly, meaning that all the hiring happens within 1 to 2 weeks maximum time. And then after that, you're pretty much expected to jump right in. So there isn't a lot of training. You're expected to know your job, be experienced in the field already. Traveling is something that is not for new graduates of any type in any capacity in the healthcare field, because it wouldn't be fair to them and it's not fair to the hospital or healthcare agency, which is needing you to come on board and jump in quickly. And so they don't really have the time to properly orient you. So it's something that, like I said, happens very quickly, great opportunity, lots of money that can be made, but there's definitely, you lose on building that community, building that relationship with the staff, and you, depending on what agency, you may potentially lose out on some benefits.
Well, we'll miss you here in the Bronx. I know that you're going to be traveling outside of the Bronx now in order to work. So, of course, we'll miss you. And a lot of things have changed for you. Not only are you getting a new position as a traveling nurse, but we've heard also that you had COVID-19. Can you share some of your experience? How are you feeling today? We're glad to see you looking better, feeling better, but just share a little bit of your experience with contracting coronavirus during this time.
Yeah. So, I just want to start by saying it's super difficult to be sick. And it's a really humbling experience to be on the opposite end of that, because us nurses, we're horrible patients. And I think sometimes because we take care of people, we forget what it's like to be the one who needs to be taken care of. And so it was difficult, obviously. I am super grateful that I had a really mild case of COVID. I just basically had lots of body aches, lots of stomach upset, lack of appetite. But I had no respiratory symptoms, thankfully. I didn't experience what most people experience with being short of breath, with having a low oxygen saturation. I did not have to go to the hospital. I was able to quarantine at home and then quarantine using the New York City hospital isolation program.
Mm-hmm. I wanted to ask you about that. You know, as you mentioned, New York City offers the isolation rooms to those who test positive for coronavirus. Can you tell us more about this program and who qualifies for it? How did you sign up for it?
Yeah. So as soon as I informed some of my coworkers, they quickly were like, "Oh, this is what you should do. This program's out there." I did know the program was out there, but I'm fortunate enough to have such excellent coworkers that they sent me the information directly and said, "Look, this is the number that you need to call. This is what you need to do." So I did. I did not want to get loved ones sick. Yeah. So I called. It was actually very straightforward. There is a 212 number that you call. You do have to wait a while. Sometimes I think I waited about half an hour before I was able to speak to someone, but I spoke to a nurse who was able to give me all the information that I needed. The only requirement is that you are a New York City resident, that you have an address within the 5 boroughs, and they really don't ask many questions after that. It did take a couple of days for them to set me up. I did also call late on a Sunday night, so maybe it had to do with the timing of the situation, but I was able to get into the hotel by Tuesday and stay there for the rest of that week. I finished my 10 days of isolation as required because I was symptomatic.
Okay. And Nurse Nada, do you have that number to share with our viewers, in case somebody's listening now and they're seeking to find out more about the program?
Yes, I have the number. It's 1-844-692-4692. And anyone from New York City can call between the hours of 9 a.m. and 9 p.m., 7 days of the week.
Perfect. Thank you. And Nurse Nada, just to clarify, are there any out-of-pocket costs that somebody would have to dish out in order to participate in this program, or is it all free and funded by the city?
No, this program is 100% free and funded by the city, and that's something that they make very clear to you once you call. I think that really helps to alleviate concerns, because the people that are calling are already sick or their loved ones are sick, and these are already confusing and anxiety-provoking times that we're in. So it's great that they are no cost. They actually will coordinate transportation to and from the hotel if needed. There's actually 3 hotels right now that are still taking COVID-19 patients. 2 of them, I believe, are in Manhattan. The one I stayed in was in Tribeca, the Sheraton Hotel in Tribeca on Canal Street. And there is also one by LaGuardia Airport. It's actually the LaGuardia Plaza Hotel.
Gotcha. Thank you for sharing. I want to shift gears here, and I'd like to explore COVID-19 vaccines. Recently, we've seen some pretty scary headlines, such as the Norway, story about reviewing deaths of frail and elderly patients vaccinated against COVID-19. Another headline was about California shelving a batch of Moderna vaccines over allergy concerns. The only headlines here so far in New York, however, are that the city might run out of vaccines soon. From a nurse's perspective, can you help us break down what happened in each of these individual cases, and if people should be worried here in New York City about the vaccine?
Absolutely. So what happened in Norway was really unfortunate. It seems like the Norwegian government, what they did was focus on trying to get the elderly and those in nursing home or group homes the first doses of vaccines. So apparently, after receiving a dose of Pfizer, the Pfizer biotech vaccine, 23 residents of a nursing home in Norway did pass away. The reasons why the cause of death is actually still being investigated by the Norwegian authorities. What I did read when I did some research on this was that majority of the residents who did receive the vaccine already had chronic health conditions and were already in either terminally ill or their health was basically failing. So it's truly hard to pinpoint without, I guess, an autopsy being done on these 23 individuals, the exact reason for cause of death. Is it alarming? Yes, it's definitely very alarming, but this is not the typical, the majority of the population. Majority of the population in most countries is young or middle-aged and does not suffer from chronic health conditions, and of course is definitely not terminally ill. So this isn't a good study population to try to basically to try to see if the vaccine is truly not effective or it's dangerous. This is not the right population to look at it, and we should not see it through this lens, because if we do, then we're obviously just going to be scared and say, hey, we're not going to take the Pfizer vaccine.
And as we understand, the first phase of recipients, not only here in America, but I guess in Norway as well, they implemented the same phases. The elderly and people with underlying conditions were one of the first to get these vaccinations. So as, the community starts getting access to it, younger folks are able to qualify for it, then they can figure out, I guess, how that works, how the vaccine works a little better. Is that what we're saying also? It depends on the research.
Yeah, definitely depends on the research. They've been working on this vaccine for over a year now. I think that's something that's pretty common knowledge. And again, there are definitely concerns, and there are concerns that are valid, absolutely. And anyone who is choosing not to take the vaccine, I personally would not blame them. It is a very personal decision. It's the same thing like when you're taking a flu vaccine. Is the flu a national, worldwide pandemic? No, it's not. So it's different. But the choice of you taking the vaccine or not is definitely one that's very personal. And of course, just like anything, all vaccines have some side effects. There's definitely been lots of talk in the nursing community, especially on social media, about nurses sharing their individual experiences. The overwhelming majority of nurses that have gotten the vaccine that I know of have had very minimal symptoms. There's been arm soreness at the injection site. There have been some fevers and some body aches. However, they've been very, very minimal. I think the overwhelming feeling overall amongst healthcare workers is that both Moderna and Pfizer's vaccines are effective and safe.
Got it. Thank you, Nurse Nada, for sharing. The other headline that I wanted to discuss was about the California shelves batch of Moderna vaccines. They threw away a batch of Moderna vaccines over allergy concerns, just to put it blatantly. Can you tell us more about this story as well and what happened there?
Sure. So what happened was they opened up the stadium in San Diego, where the San Diego Padres, their baseball team, plays. I think it's called Petco Field. And they actually converted that into a mass vaccination site. So what happened was about 10 people, after receiving the injection at the same site, so I believe, I'm not sure which arm it was, but at the same site, they developed severe allergic reactions. So what the San Diego Health Department decided to do was to dispose of that specific batch. So vaccines, when they're created, they have a lot number. And so they can be traced to exactly where they were created. Of course, depending on who made them as well, which company created the vaccine. But basically, it can be traced down. So what they do is, if there is a concern about the vaccine being safe, that batch being safe, they'll get rid of the entire batch.
Okay.
So that's what they did. So they threw out the remaining doses that were together with the same lot number.
Got it.
And out of overwhelming concern and caution, because they didn't want this to continue if it was a problem with that batch. Like everything, there could always be a bad batch of anything that's made in a factory. There is nothing that is 100% like foolproof. Quality assurance is done, but I guess that was a bad batch because those people experienced that reaction. Again, it was less than 10 people. And the health department got involved right away, did the absolute right thing. I think it's noteworthy to say that there were 200 other sites in California. California has received over 1 million doses of the Moderna vaccine. California is obviously a huge state, and the COVID rates in California are through the roof, unfortunately. I think we've heard a lot about LA and the issues that they're having with actually physically maintaining the deceased bodies. So we know how bad it is in California. So California has received over 1 million doses just of Moderna vaccine. I think it's worthy to say that this vaccine was also, Moderna has been distributed to over 200 injection sites in California, and no other sites are reporting issues. So I think that can boost confidence a little bit for people in California.
Thank you so much, Nurse Nadi, for helping us break that down. Because, as you know, when we're on social media looking at these headlines, we immediately get, scared. There are a lot of new developments coming out, a lot of news coming out regarding the COVID vaccine. So we want to make sure that we keep our Bronxites informed. So thank you always. Before we go, can you just leave us with a message to the community on keeping safe during these times?
Absolutely. I think that we obviously need to continue doing what we're doing here in New York. I think we've done a pretty excellent job. I know rates have gone up everywhere, but for being such a huge city, I think we've done a fantastic job. I want to say thank you to all the New Yorkers who are doing their part. I know so many of them are working from home, teaching their children from home. It's been so difficult, but I think we're finally seeing light at the end of the tunnel. And that's an amazing thing to say today in light of the inauguration as well. We just have to continue to do what we've been doing. Continue to wash our hands, continue to wear our mask 100% of the time. Don't let up at all. And of course, if anyone is sick, CDC guidelines say if you test positive and you don't have symptoms, you should isolate 10 days from when you tested positive. If you test positive and do have symptoms, you should isolate 10 days from when your symptoms began. It's also it is safe and recommended to get another COVID test after the 10-day period and make sure you are negative. That is what I did. Before I stopped wearing my mask, even inside my home, I made sure that I was negative. I think that's really, really important. If people have issues getting tested, please reach out to the city. Also, I want to give a shout out to where I went to go get seen, the Institute for Family Health on Walton Avenue, 1894 Walton Avenue. They do PCR COVID testing, so results take 2 days, but they have a whole area dedicated just to do COVID testing. So definitely patients from the Bronx can reach out there if they need to.
Thank you so much, Nurse Nadi, for joining us once again. And thank you for your work, your tireless efforts during this pandemic. Thank you.
You're more than welcome, Sonyi. Thank you guys for having me again. Please take care and stay safe.
Yes, you as well. Nurse Narelia Oliveras-Arzuaga will be joining us occasionally here on Open BXRx. So, expect to get updates from her more often. We'll be right back with Open BXRx. Welcome back. The pandemic has continued to impact the workforce, with New York City's most recent unemployment rate at 12.1%. In order to ensure that all New Yorkers have the opportunity to benefit from an expanding tech sector, Merit America provides a path to skilled careers for adults without bachelor's degrees. And they're bringing fast, flexible, and focused programs to New York City. Joining us now to share more are Connor Diemand-Yauman, co-founder and co-CEO of Merit America, and Sandra Massie, a learner at Merit America. Welcome. Thank you both for joining us today.
Thanks. So great being here. Thanks for having us.
To start off, Connor, can you just tell us about Merit America and your mission?
Merit America was built on the idea that merit, not money, should determine your job prospects and access to opportunity. And all too often we see that this isn't the case. You know, your race, your gender, whether or not you have a 4-year degree, that locks you out of certain opportunities. And so what we have built at Merit America is a new pathway for working adults. This is world-class training that folks can take while they keep their jobs, while they socially distance, while they take care of their families and and take care of their other obligations, and can access new skills that will put them on a pathway to a new career. On average, our learners come in making around $25,000 a year, and on average, they leave making over $45,000 per year. So that's nearly a 75% wage gain. And we train working adults in high demand fields, giving them a new access point into a career in tech. And
Connor,
that's right. Yeah.
Sorry about that. What are some of those career paths and courses that students can take right now at Merit America? What are some of those courses and things that they can benefit from?
Yeah, great question. So our programs they're fully virtual, lasting between 9 and 24 weeks, and we offer a number of programs. What we're most excited about to launch in the Bronx in New York City is a IT support specialist, and we created this track in partnership with Google. And graduates receive a IT support certificate from Google, which they can then get transferred for credit at over 100 different colleges and universities across the United States. And this certificate really is the first step into a new career in tech. And Sandra has a really inspiring story showing, one of the many paths that this particular track can take you.
Yes, let's speak to Sandra. Sandra, please share your experience with us. What led you to pursue the tech industry, first of all, and how did Merit America help you on this path?
Before I met Merit America, I was a restaurant manager. I had worked on the hospitality industry for over 8 years, and I was still struggling to make ends meet, living from paycheck to paycheck. I was working crazy hours, like 65 to 70 hours a week, always on my feet. And I really wanted more. I wanted more from my career. I wanted more from my life, have more time to spend with my children, like holidays and other things that I saw people having. And I was like, I deserve this too. I always love technology and I always love computers, but I always thought that I wouldn't have a chance being a woman and being an immigrant to this country to find a job like that. And Merit America helped me not only with the IT certification that I got from Google, but also with career coaches. So I learned how to make a resume. I learned how to carry myself on an interview, what to look for on a better job, and that really helped out.
That sounds amazing. And maybe people that are viewing now will recognize you from seeing you on other programs on television. Can you just tell us about, where your career path has taken you?
I have been working for 2 years as an IT consultant, and I love my job. I have had the opportunity to just learn and take other certifications through my job. So that was really the entry point for me. And I have done so much, growing on my job, growing my career. I'm leading now a new project on my company, and it just makes you feel the sense of fulfillment and really achievement from those things.
You have an amazing story that I'm sure that a lot of Bronxites will be able to relate to, people seeking a different path. So thank you so much for sharing that. Connor, I wanted to bring it back to you. How can one qualify to start their tech journey with Merit America? Do you need any type of tech experience or any degree of any sort? Are there any expenses for tuition fees? Can you just share a little more background on that?
Yeah, such a great question. So we accept folks who have a high school diploma, but you do not need a 4-year degree. You do not need any experience in technology. You don't need to have an IT background, but you need to have a real interest and passion in tech. So that's something that we find is so super important for folks who succeed in our program. Leaders like Sandra come in, and while they might not have a tech background, they might have dabbled in some technology, or they just have a real passion for breaking into technology. In terms of, so it's very open. Anyone can apply. In terms of costs, this is one of the aspects of our program of which I'm most proud, and that is you pay nothing upfront, and you only pay if you get a job making a certain salary in technology. And so if you don't get a new job as a result of our program, if you don't get into technology, you don't pay anything. And if you do get that job, then you pay a flat, predictable fee for a period of time afterwards. But you only pay if you get the outcome, and that's something that we've been really proud of, to create a new type of payment model, because we want our success to be your success. And if we don't deliver on our promise, you shouldn't have to pay us.
That sounds amazing and feasible enough for us here in the Bronx for sure. Passion and $0 up front. What more can you ask for,
Yeah, exactly.
I also wanted to ask, how the schedule works. Let's say someone has a job and they want to take tech training with Merit America. How does that work?
Yeah, so one of the main reasons that we are different from, say, going to community colleges or other training providers is that we are totally flexible. So we are designed to work for people who work. And that means that the majority of the programming is actually self-paced. You do it on your own time. And then we have one-on-one meetings with your coaches or group meetings with your fellow classmates, but these are fully virtual and they're built around your schedule. Sandra, I don't know if you want to share anything about your experience.
Yes, it works 100% while you're working, because you can just take the classes when you are ready, so after work or before work. And then with the virtual meetings now, you can have the squad meeting with your coaches totally online from the comfort of your house, from your laptop. So it works for working people.
That is a super important topic for people in the Bronx, especially, people are working,
Yeah.
They want to balance their lives and their job at the same time. So thank you for sharing that. Connor, how has COVID-19 impacted tech careers? If you can share, for Merit America, is the tech sector immune to this pandemic? Would you say yes or no?
Oh, it's such a good question. I would say that no, every sector has been impacted in some way by COVID-19, but tech has been, I think, more protected than most of the sectors. And this really speaks to one of the values of our program, in that we select high growth, stable career trajectories. So we are actually we only train in jobs that are resistant to pandemics, where people can grow their careers and get wages that allow them to support their families. And that's been proven over the last year, in that, our graduates are keeping their jobs, and we're able to continue placing graduates in these jobs because we've identified job categories that are really high demand, high growth, and highly stable, in that we know that 5 years out, this is an area worth betting on.
Right. Got it. And why was it important for you to expand to New York City and seek people who are interested in tech careers here in the Bronx in particular?
Yeah, I think so we went through reams of data around different cities in the United States, and these are looking at cities that they're best positioned for our types of services. Again, we're a nonprofit, and we want to serve as many people as we can. And New York was at the top of the list, and the Bronx in particular has a high concentration both of potential learners, of kind of talent supply, and a high concentration of employers who are open to hiring and expanding. And so when you look at these variables, the Bronx and New York City more broadly was our top market for expansion as we spread across the country.
Got it. And Sandra, are you working mostly remote nowadays due to the pandemic with, your tech?
Yes, we were able to transition to working from home, which was a great help because my daughter is also out of school. So it gave me the opportunity to not have to stress about who's going to take care of my daughter, how she's going to do in school. I'm here with her every day and I'm able to do my work. My company recently passed a very generous time off policy, so I can have time off to do with her things that I haven't seen from colleagues that I have that are still in the restaurant industry. Most of them have lost their jobs. And I just promoted Merit America to them. And I was like, hey, just come to Merit America because you can get a certification and get a different career path.
Absolutely. Thank you both so much. Before we go, without further ado, I know people are listening and anticipating, how can I find out more? Where's the application? Connor, if you can just provide that information for our viewers at this time.
Absolutely. So you can apply and learn more about our programs at meritamerica.org. So meritamerica.org. And I'm going to do something crazy just because we care about New York and the Bronx so much. You can also email me directly if you have questions. We want to invest in this community. We want to support you all in getting that career in technology. We care about you and we want to show up right for the Bronx. So you can feel free to email me directly at Connor, CONNOR, at meritamerica.org. So Connor at meritamerica.org, but no spam, please.
Can't make any promises, Connor. No,
Yeah.
You'll probably get a lot of inquiries from our Bronx sites, but thank you both so much again for joining us and sharing this incredible venture that's coming here to the Bronx and to New York City in total in February. Thank you all so much.
Thanks so much for having us.
Of
Thank
course.
you.
Bye.
Again, folks, you can visit meritamerica.org and you can also follow them on Instagram at We Are Merit America, Facebook at Merit America, and Twitter as well to stay connected. We'll be right back.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at bronxnet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Our next guest recently created a hub for independent creators to share their content and music while networking and selling merchandise to help monetize their work. Joining us now to share more about Digital with a V is founder Mwosa Edosomwan. Thank you so much for joining us, Mwosa.
Thank you for having me.
Of course. First, to start off, can you tell us about your platform, Digital, and your mission with this platform?
So Digital is basically to help the independent artist monetize from their talents right now online. Right now, a lot of artists are not making the money they could be. Usually they're going in with a price on their head, trying to make their art and share it, like with their fan base, but they're not able to recoup like some of the signed artists that we see, because they have more of like a system like behind them. So I just figured, like, because we don't have, like the access to all of these tools that these bigger artists are using to try and monetize, I just chose to kind of build it all into one platform where it'll be a seamless, just click and do, like for the independent artists.
Got you. And when did you launch digital, if I may ask?
I launched digital last week, Friday, on the 15th.
Congrats.
Yeah. Thank you.
And
Thank you, I appreciate
what exactly inspired you to start this initiative during this time, especially, when we're all in this digital realm, and artists, like you said, have lost a lot of money during this time because there's no performance venues to perform at. Just, tell me what inspired you to start this initiative.
Just being like an artist myself, you know what I mean? Like, I know that, just years ago when I started going on this adventure of trying to put out music and then seeing what it took, I seen that it would cost money. And then sometimes it's just like, you need you kind of needed a certain amount of money to even just get your music rolling, not even to talk about trying to like recoup it. And it just led me into finding ways that I could try to cut my costs. Like, oh, maybe I should have a website, maybe I should have a store, maybe I should do this, maybe I should sell merch. But all of this was too scattered, and it wasn't all in just one central place for me to find it. It's kind of like one of those things where you have to just uncover, like the hidden gems to know how you're going to monetize, especially if you're not a signed artist. So I just figured, when I got really good into like technology and building websites and building apps and stuff like that, I just figured, I said, you know what? A lot of these tools are like open source. Let's drag them together into a hub, into one platform where now, any artist can just sign up and just start to just use it right away.
I think it's amazing. And let's say, that there's an artist listening right now to this interview. What types of things can they do through this digital app? What are some of the resources that they have available to them if they sign up?
Okay, so if you are an artist and you come to digital, immediately out the gate, you're able to upload your music to the platform, which one just gives you more reach to people that are searching for it. Two, you earn points when you engage with other users on the platform, which now, that means liking a song, commenting, and you can use it and you can spend those points once you've earned enough of them to try to unlock certain perks. That could be maybe having your song premiere on a floating banner for, like a few days. That could be, maybe unlocking maybe like a t-shirt that you could use to promote your platform. But also when you come to the platform and you uploaded music, you can also sign up to get your store open where you're able to bundle your merchandise, your music, your albums and stuff like that. So you have more tools than you would have maybe just starting your own website. You kind of have it all in one hub. And then you can even bundle things, which really, really, fans do like the fact that they can, buy a sweater and then maybe get your single inside their email. So,
And Mwosa, is this open only for artists, or are you seeking like to open this to other type? I mean, only for musicians, or is it open to like any type of artist? What type of artists can sign up for digital?
So right now we're open to any, singers, rappers, like producers, anyone who makes music right now or makes content that can be streamed. They can basically get on board. So right now we are for the artists, but it's definitely, we will be having updates where it's going to accommodate anyone who's online and likes to make things. So that could be a podcaster, that can be someone who likes to do covers and stuff like that. It's really a hub for all kinds of, sonic makers is what I like to call them. And basically what that just means is if you can create a sound, you can upload it to digital and you can immediately start to monetize it.
Copy. And I wanted to ask you, how has the transition from physical albums to now digital content helped or hindered an artist's ability to monetize their work specifically? Can you share the pros and the cons of a completely virtual artist realm?
That's a good question. So the transition from the CD to the stream, what that did in terms of how it helped now like the independent artist is that it gave the artist more ways for him to find different kinds of exposure. And anyone could blow up from their household. Like, you know what I mean? They can make a song in their bedroom, tomorrow they blow up, because these platforms have to draw in lots of users, so they end up pushing out content that would attract them in. How it kind of took a default now is that, you know, the CD used to be a tangible item that someone would have to pay for to receive. Now the artist really isn't monetizing his music, but the platform monetizes off of their music, not the actual artist. So now what that tends to do is, I used to maybe get $1.29 anywhere to about $12 for a song or a body of work. Now I can put out a body of work and not even earn a penny, no matter how many times that it's streamed, unless it goes over a certain amount of streams. I'm not even making $1 off of something I might have poured in thousands of dollars to make. So, you know, right now inside the virtual world, now you get the exposure, you get the clicks, you get the streams, but you don't get the money, and it's going to, you know, a tech company that's about to sell and cash out for billions of dollars off of your content.
Right. Thank you for sharing, Mwosa. When I think about a ownership and a platform that serves artists specifically, I think about a medium like Tidal, right? But we also have digital now. Is there any other like platform that's doing what you're doing? And how is digital different from something like Tidal or another platform that may exist for an artist today?
So right now there are different platforms that really are not heard of. So, you know, like Slaps is a kind of an offset of DistroKid's kind of streaming platform, where they try to make an engagement social platform for some of the music, kind of just helping artists grow their fan base. But besides some of the smaller ones, if we're just comparing digital to Tidal, it's very different, because digital serves as a one-stop shop. Tidal is more of like a streaming service. You earn money off of streams. Digital is more like every single aspect that the artist can monetize their content is what we shoot for. So now not only can you have an e-commerce store where you can sell like your merchandise, or, you know, sell your album, but you will be able to license your music to other companies through a smart contract. And all of these things are handled for you. Really, all you would do is upload your music, and when a platform wants to run an advertisement on the platform, they have to choose music that exists on the platform to license and utilize. This automatically pays the artist. And if people don't know, licensing is really where the wealth comes in when it comes to music, not streams, because gaming companies are paying thousands of dollars just to use one song, you know. And as an artist that's in your bedroom, you know, you've been making, you know, tons of great music. For you to see a $5,000, $10,000 check for one song just to be licensed, that's incredible. But you know what I mean? We don't have the access to the knowledge or the tools. So that's where digital comes in. As for other kinds of streaming services, you might just get that exposure now because of you know, just maybe a playlist. If you make a playlist, and you know, you're kind of just hoping that you just earn some streams, where there are so many other ways for artists to monetize their music, so many others.
Absolutely. And let's talk about a friend that we have, a mutual friend. Joel Blue is an artist here in the Bronx, and he recently launched, well, he helped you launch digital by having his stuff there, his merch there and everything. How did that go, and how were, you know, his numbers looking after promoting his stuff through digital? I know that it was a great success for you both.
Yes. So first I have to just go into the story. Really, it's just Blue had made a post about how much money he was pouring into making his album. And I just, you know, his story is what really touched me and made me want to even build something like digital. Because then I saw, you know, I kind of just called him up and I just asked him, I said, do you have any plan to recoup any of the money that you put in? And at this time, I think he said he put in about $5,000 to $7,000 to just make his album. And then I'm just like, sheesh, bro. He's like, you know what, man, I didn't really have a plan to recoup. I kind of just did it for the art. But now that I see I'm spending a lot of money, I would like to. And I said, yo, bro, like, I'm launching this platform in a few weeks. It'd be really great if we could use you as almost like a you know, like a tester. You know, if you want to take that chance with us, just launch your platform, launch your album with us first, and then we see how we can help. And then, you know, he kind of said, you know what, bro, I'm going to only launch my stuff on your platform for at least 2 to 3 weeks. And then, you know, like, let's see how it goes. He launches, and, you know, I work with him directly as to how to bundle things, showing him how to bundle. If there's any errors that came up inside of the server, you know, he was gonna have to take that risk with us. Finally, as he launches his merchandise, immediately he's getting like 10, 15 sales every 2 or 3 hours.
Wow.
And he ends up, I don't want to say his number, but he ends up cracking like 3 to 4 digits within just a few days off of sales, just because people could buy these bundles in which that he had. And he showed me, you know, him having such a small fan base and making more money than he has followers. It was just like, okay, this works.
Yeah.
This works, and this could benefit different kinds of artists as well.
Word. So if you're listening, hit up digital. It does work. I saw for myself too. For real. And I'm super proud that, you know, this is happening here in New York. Mwosa, are you from the Bronx, by the way?
Yes, I am from Bronx, New York, uptown.
Hey.
I gotta represent.
You know, I wanted to ask how you got into the tech field as well. Like, when did you start, you know, exploring the tech field and learning about it, and, you know, adding and applying this knowledge to this platform that you've created?
Yeah, so I've always been into just like computers. I love technology. I love how systems come together and work. So, you know, I started coding through maybe playing like some video games and trying to learn how to hack them at like age 9. So then kind of like from there, I went into like, you know, we all had a MySpace page. So, you know, you're like changing the background colors, you thinking that you know how to code. And that's, you know, that just started helping me just kind of start to explore more of it and more of it. Now, when I take some time off, but when I get into college and I want to launch a website, I have so much different kinds of experience from launching my website. But then I started asking myself, like, how do I add features to a website? How do I add functionality? And just building on top of that, when I would launch my own website for my own music and for my own merchandise, I'm like, you know, there's got to be an easy way to just make all of this seamless, because I don't have a big record label with marketers and with graphic designers or with someone who can manage my store. How could I put all of this in one platform where almost like the computer is working for me? And then, you know, when I started getting into studying that and then combining it like with business, I just said, you know what, it just makes so much sense that technology is disrupting life right now, period. So instead of just allowing the wealthy people with access to hire all these people have these things, let's build these things for people that don't have the access to them, so that they don't get lost in this transition to everything going digital. And that's really what inspired the name Digital. Really.
Wow.
Yeah.
Great way to tie it up. Thank you so much, Mwosa, for your time. And, you know, before we go, how can people learn more about digital, follow you, inquire, ask any questions, all that good stuff? Just give them the whole foundation right here.
Definitely. So definitely tap in with digital. You can follow us at digital, DIGITVL with the underscore. You can go to digital.com, DIGITVL. Check it out. Just sign up. You know, like once you sign up, we have how-tos, we have a support base that you can reach out if you have any questions. Definitely sign up, try to get a store, reach out to the Instagram page. We're offering the greatest customer service now because we know that we are a new platform. So we're answering all people's questions and just helping them get started online. So tap in with us. We do have some YouTube pages coming out, you know, like some documentaries with other artists showing their, you know, kind of their climb and how they're going to be using digital as well.
Thank you so much for your time today, and best of luck to you with this digital platform.
Thank you.
I personally love it. I'm a little biased, but take care. Thank you so much for bringing this to, you know, to independent artists and especially people here in the Bronx who are seeking these avenues to monetize off of their work and their art as they should.
Thank you. I appreciate it.
Mwosa Edosomwan is a Bronxite and also the founder of Digital. It's a platform and a hub for independent creatives here. Again, if you're interested in learning more, you can visit Digital with a V. So that's DIGITVL.com. You can follow at Digital. It's on the screen _ on social media. That's all for our show today. I'm your host, Sanji Lopez, wishing you and your family safety and wellness now and always. Take care.